Have you ever felt this way? You wake up one morning and your back feels stiff, your hips feel heavy, and you wonder for the 100th time whether this is arthritis or just another day of back pain. It's confusing, isn't it? Because the deeper the discomfort becomes, the more all those sensations start to blend together. One of my patients once shared that she had spent nearly 5 years assuming her pain was severe arthritis. She tried creams, supplements, and even stopped doing the activities she loved because she feared her joints were wearing out. But when she finally came in for an exam, we discovered something completely different. It wasn't arthritis at all. It was a nerve in her lower back being pinched day after day, silently altering her life without her realizing it. I want you to imagine this. Your body is like a complex orchestra, and every joint and every nerve has its own voice. When a single instrument plays the wrong note, it can sound almost identical to another. That is exactly why so many older adults mistake arthritis for back pain or back pain for arthritis. The symptoms echo each other, they mimic each other, and without understanding the difference, people end up treating the wrong problem while the real issue continues to grow quietly underneath. Over the years, I've met countless seniors who told me they were certain their knees or spine were inflamed, only to learn that the true cause was muscle tightness, nerve irritation, or wear and tear in a completely different part of the body. Science shows that more than half of adults over 60 experience both arthritis and back pain at some point, which makes it even harder to distinguish between the two. But there are clear differences, and once you understand them, everything changes. You'll know which exercises help instead of harm. You'll know when to rest and when to move. And most importantly, you'll know what your body is trying to tell you. So in today's journey together, let's gently untangle this confusion and help you finally understand the difference between arthritis and back pain in a way that feels simple, empowering, and deeply supportive for your everyday life. Now that we've opened the door to this conversation, I want to walk with you slowly and gently into a deeper understanding of what's really happening inside your body. When you hear the words arthritis and back pain, it's natural to think of them as almost interchangeable. After all, both bring discomfort, stiffness, and frustration into your daily routines. But beneath the surface, they come from different stories your body is trying to tell you. And once you learn to hear those stories, everything becomes clearer. I want to take you back to a moment early in my medical career when an older gentleman named Bernard walked into my clinic. He moved carefully, one hand pressed to his lower back, the other gripping the arm of the chair as he sat down. He told me with absolute certainty that his arthritis was flaring again. "It's the same old arthritis, doctor," he said. "My back is angry today." As I listened, something didn't quite match. His pain was sharp and traveled down into his thigh. His back muscles were tense. There was no swelling in any spinal joint. After a gentle examination, I told him that what he was experiencing wasn't arthritis at all. It was nerve irritation coming from a disc in his lower spine. He stared at me, surprised, and said, "But the pain feels the same." In that moment, I realized just how easily these conditions confuse people. The truth is that arthritis and back pain can feel similar, but they originate from entirely different mechanisms. Arthritis is inflammation inside a joint. Back pain, especially in older adults, often comes from muscles, nerves, discs, or spinal alignment. They are different languages spoken through the same part of the body, which is why so many seniors assume one when it's actually the other. To understand arthritis, imagine a hinge on an old wooden door. When the hinge is new, it opens smoothly and silently. But as the years pass, the metal wears down. Dust gathers. The hinge becomes dry. The door starts to creak. That creaking's inflammation, the body's way of signaling that the joint is being worn down. In arthritis, the cartilage that cushions your bones becomes thinner, and the bones begin to rub against one another. The body responds by sending fluid and inflammatory cells to the joint. That's why arthritis often brings swelling, warmth, and that familiar morning stiffness that takes a little time to loosen up. Now imagine something completely different. Picture a thick rope that runs down the center of your body. That rope is your spinal cord. And from that cord, delicate branches extend outward like the limbs of a tree. These branches are nerves that carry messages to your legs, your hips, your muscles, your skin. They are sensitive and easily irritated. When a disc bulges, when a muscle tightens too much, or when a vertebra shifts slightly out of place, it presses on these nerves like a pebble pressing into your shoe. That pressure causes pain, numbness, tingling, or weakness. This is back pain, and it behaves very differently from arthritis. One of the clearest distinctions lies in how the pain moves. Arthritis stays in the joint. If it's arthritis in your hip, the pain stays in the hip. If it's arthritis in your knees, the discomfort stays in the knees. But back pain, especially when nerves are involved, loves to travel. It can shoot down into the thigh, wrap around the lower back, or create that electric crawling sensation down the leg. When a patient tells me their pain radiates, I instantly suspect the spine rather than the joints. There's another difference that many people overlook. Arthritis often improves with gentle movement. The more you walk around or stretch lightly, the more your joints warm up and loosen. But back pain, especially nerve-related pain, may worsen when you move a certain way. You might bend forward and feel a sudden pinch. You might twist your torso and feel a spark of discomfort. Arthritis whispers at first and then gives up as you move. Back pain sometimes shouts when you ask your body for certain motions. But one of the most important things I've learned from decades of caring for older adults is that the body rarely misleads you without reason. When something feels off, there's always a cause behind it. Sometimes it's a joint, sometimes it's a nerve, sometimes it's a combination of both. What matters is learning to understand the subtle signs so you can respond wisely. I've seen this confusion across generations of seniors. They tell me their hips hurt, and when I examine them, the hips are fine. It's their lower spine referring pain outward. Or they tell me their back feels stiff, but the real issue is arthritis in their sacroiliac joints. They've spent years treating the wrong thing, simply because nobody ever explained the difference in a way that felt clear and human. That's why I want you to picture your body not as a collection of random aches, but as a detailed map. Every sensation has a meaning. Every type of pain has a location, a pattern, a rhythm. When you learn to read that map, you gain control back over something that once felt unpredictable and overwhelming. In this journey, clarity is everything. And in the next section, I want to help you see these differences so clearly that you'll never mistake one for the other again. You'll know what arthritis truly feels like, you'll know what back pain truly feels like, and you'll understand exactly what your body is trying to say when one of them appears. As we continue this journey together, I want to take you deeper into the unique personality of each condition. Arthritis and back pain are like two neighbors who live on the same street, yet behave completely differently. They may both knock on your door with discomfort, but the way they interact with your body and the way they respond to movement, time, and rest are entirely distinct. Let's begin with arthritis. To truly understand it, imagine a joint as a delicate, beautifully engineered cushion. When we're young, that cushion is thick, hydrated, and resilient. It absorbs shock effortlessly and allows us to move without thinking. But as the years pass, the cushion starts to thin. Tiny cracks appear. The once smooth surfaces begin to roughen. And slowly, the body responds with inflammation, swelling, and stiffness. That is arthritis gently announcing itself. One pattern I've seen over and over again is how arthritis loves the morning. Not in a pleasant way, but in a way that makes those first few minutes of the day feel like everything is stuck. Many seniors tell me they need time to warm up before their joints feel like they belong to them again. This morning, stiffness is one of the most classic signatures of arthritis. Interestingly, once you start moving around, the stiffness begins to fade. Joints come alive with circulation, and the pain softens. That's because motion is nourishment for arthritic joints. Gentle movement lubricates them, like oil easing a rusty hinge. Back pain, on the other hand, plays by a totally different set of rules. It doesn't wait for the morning. It can strike at any hour and in any posture, And unlike arthritis, movement doesn't always help. Sometimes it makes things worse. I've met many older adults who tell me they can walk just fine, but the moment they bend to pick something up or twist slightly, a sharp pain shoots through their back or down their leg. That sudden jolt is the language of nerves. When a nerve is irritated or compressed, it reacts explosively, like a live wire touched by accident. One of the clearest distinctions comes from the way the pain spreads. Arthritis stays local. Back pain loves to wander. If you feel pain that travels down the leg, wraps around the hip, or tingles along the calf, that's almost never arthritis. It's your spine sending out distress signals. Some people describe it as hot, burning, or electric. Others say it feels like a rope being pulled tightly from their lower back down to their foot. That pulling sensation is one of the most telling signs that the spine, not the joint, is involved. Let me share another memory with you. A woman named Louise once came to see me after months of treating what she believed was severe hip arthritis. She limped into my office, holding her hip as if it were the source of all her misery. She had tried warm compresses, arthritis creams, and even changed her diet, yet nothing eased the pain. When I examined her, the hip joint itself barely reacted. But when I gently pressed along her lower spine, her eyes widened with recognition. "That's the pain," she whispered. Her hip wasn't the problem at all. A nerve in her back was referring pain outward, misleading her into thinking her hip was deteriorating. This kind of confusion happens all the time. The nerves branching from the spine radiate into the hips, thighs, and even knees, so it's easy to think a joint is failing when it's actually a spinal issue. That is why self-diagnosis becomes tricky, especially as we age. The body doesn't always send clear, easy-to-interpret messages. Sometimes it speaks in riddles, and those riddles can cost people months or even years of unnecessary suffering. Another important clue has to do with how pain reacts to pressure. With arthritis, applying gentle pressure on the joint often brings a sensation of tenderness. The joint may feel warm or mildly swollen. Back pain rarely behaves this way unless the muscles are involved. The spine itself doesn't swell in a visible way. Instead, the pain lies deep, hidden beneath layers of muscle and connective tissue. When nerves are irritated, touching the skin or pressing the area may offer no clue at all. I often encourage my patients to pay attention not just to where the pain is felt, but to how it behaves throughout the day. Arthritis tends to be predictable. Weather changes, long periods of inactivity, or too much physical stress can trigger it. Back pain, however, is less consistent. Some days it's mild, other days it flares suddenly without warning. This unpredictability is a hallmark of nerve-related conditions. You might also notice differences in how you walk. Arthritis can cause you to walk stiffly or avoid putting weight on a particular joint. Back pain can cause a limp too, but usually because the nerve controlling the leg is irritated, not because the joint itself is painful. When your back is the culprit, you may have difficulty standing upright or find yourself leaning to one side without realizing it. That subtle shift is the body's attempt to release pressure from the irritated nerve. Throughout my career, I've learned that the most helpful guidance isn't just medical facts, but understanding how those facts translate into real life. Pain affects more than the body. It affects confidence, independence, sleep, mood, and the small joys that shape daily living. When seniors misinterpret their pain, they often treat it in ways that don't help. Some rest too much when they actually need gentle movement. Others push themselves when their nerves need time to settle. Knowing the difference between arthritis and back pain doesn't just create clarity, it restores control. In the next section, I want to help you learn how to recognize these differences with even greater precision. You'll discover the patterns, sensations, and warning signs that reveal exactly what's happening inside your body. And that knowledge, more than anything else, will empower you to care for yourself with confidence and certainty. As we move further into this journey of understanding your body, I want you to think of pain as a messenger rather than an enemy. Your body never creates discomfort without reason. It's always trying to communicate something, whether gently or urgently, and learning to interpret those signals can change your entire relationship with pain. This is especially true when it comes to distinguishing arthritis from back pain, because the signals may feel similar, but they carry very different meanings. One of the most powerful tools you can use is observation. Not the kind of quick, casual observation you might make while rushing through your morning, but slow and intentional attention to how your body behaves. For example, imagine you wake up with a stiff lower back and hips. Before assuming anything, sit quietly for a moment and just breathe. Then gently move. Does the stiffness soften as your joints warm up? Do you feel relief once you start walking around? If so, that pattern leans toward arthritis. Arthritis loves to cling to the morning hours, but it loosens its grip as blood flow increases and the joints find their rhythm. Back pain, especially nerve-related pain, has a different pattern altogether. A nerve can be quiet in the morning and then ignite with the slightest movement. You might bend over to pick up a towel and suddenly feel a stabbing sensation that spreads across your lower back or down your leg. This kind of pain doesn't fade simply because the day begins. In fact, it can become more unpredictable as the day goes on, sometimes flaring after long periods of sitting, standing, or lifting. Another valuable clue comes from posture. When someone walks into my office with arthritis, their posture often looks steady but cautious. They move with care because certain joints feel achy or stiff, but their alignment is usually intact. When someone has back pain, especially when the spine is involved, the posture tells a different story entirely. They might lean slightly to one side, walk more slowly, or avoid putting full weight on one leg. Some people even shift their upper body without realizing it, creating a subtle curve in the spine to relieve pressure on an irritated nerve. These unconscious adjustments reveal more than people realize. There's another difference that many seniors overlook. Swelling, arthritis by nature, is an inflammatory condition. The affected joint may appear puffy or warm, especially after a day of activity. You might notice the skin around the joint feeling tighter or more sensitive. By contrast, back pain rarely causes visible swelling. Even when a disc is herniated or a nerve is inflamed, the surface of the back looks unchanged. The source of the pain is buried deep beneath muscle layers, far from the surface where the eyes can see. Let me share another story that beautifully illustrates how the body speaks if we learn to listen. A man named Harold came to see me after years of assuming his left knee was succumbing to arthritis. He had stopped gardening, avoided stairs, and even limited his morning walks because every step felt draining. When I examined him, his knee barely reacted. But when I asked him to lie down and gently lifted his leg, a sharp pain shot down from his lower back, through his thigh, and into his knee. His eyes opened wide in realization. The knee wasn't the problem at all. The real source was a pinched nerve in his lumbar spine. I often tell my patients that nerves are tricksters. They like to disguise themselves and play hide and seek with pain. A nerve can create the illusion of joint damage, even when the joint is perfectly healthy. This is one of the reasons why so many older adults misdiagnose their own discomfort. They treat the wrong area, apply creams to the wrong spot, and stretch muscles that aren't causing the issue. But once they understand where the pain truly originates, the path toward relief becomes so much clearer. Another critical distinction lies in how each condition responds to rest. Arthritis often improves with rest, but too much rest can actually make it worse. A joint that isn't moved becomes stiffer and more painful, but nerve-related back pain reacts differently. Sometimes resting in certain positions brings immediate relief. Other times, lying flat can worsen the discomfort depending on which nerve is involved. If the pain improves when you bring your knees slightly toward your chest or worsens when lying completely straight, that's a sign of spinal involvement rather than arthritis. One of the most surprising things I've observed over the years is how strongly emotions and stress influence back pain. While stress can certainly make arthritis feel heavier, it often has a more dramatic effect on the spine. When we're anxious or overwhelmed, the muscles around the spine tighten to protect us, almost like armor. But that armor can become a prison. Tight muscles compress nerves, restrict movement, and make back pain feel sharper and more unrelenting. Arthritis doesn't respond as intensely to emotional tension, which becomes another subtle clue. As we age, it's also important to acknowledge that many people experience both conditions at the same time. Arthritis in the hip can coexist with nerve irritation in the lower spine. In those cases, the pain patterns overlap, and separating one from the other becomes more challenging. But it's still possible and incredibly helpful to understand which sensations belong to which condition. When someone can say, "This pain feels deep and sharp, that must be my nerve," or "This stiffness fades when I move, that's my arthritis," they gain a sense of control that transforms the way they navigate their daily life. My goal is not just to help you understand the science, but to help you rebuild confidence in your body. Knowledge is power, and the more you understand your pain, the less frightening it becomes. Instead of worrying, you begin to observe. Instead of guessing, you begin to recognize patterns. And instead of feeling helpless, you begin to respond with purpose. In the next section, we will go deeper into how you can manage each condition effectively. You'll learn gentle movements, helpful habits, and supportive daily practices that strengthen your joints, calm your nerves, and help you live with more comfort and freedom. This is where understanding meets action, and where confusion finally turns into clarity. As we bring all these threads together, I want you to imagine sitting at your kitchen table with a warm cup of tea in your hands. Outside, the morning light is soft, and the world feels quiet. Now picture yourself tuning into your body the same way you would listen to a close friend. With patience, with curiosity, with compassion. That's how I encourage my patients to approach their pain, because the body is not an enemy trying to sabotage you. It's a lifelong companion trying to communicate in the only language it knows. This final part of our deeper exploration is about understanding not only the differences between arthritis and back pain, but how you can support your body in ways that create lasting relief. When you know the personality of the condition you're dealing with, your choices become smarter, your actions more effective, and your healing more complete. Let's start with arthritis. Living with arthritis doesn't mean you must accept a life of constant stiffness or limitation. In fact, one of the most powerful things you can do for arthritic joints is to keep them moving gently and regularly. Think of motion as nutrition for your joints. With every slow stretch, with every soft step, you invite fresh blood flow and warmth into the places that feel tight or tired. That warmth helps ease inflammation and keeps the joint surfaces healthier. Many of my older patients find that simple activities like morning walks, light gardening, or slow water exercises bring tremendous relief. These movements help the joints open, loosen, and glide more comfortably. It's also helpful to remember that arthritis responds well to consistency. You don't need intense workouts or dramatic lifestyle changes. What your joints crave is steady, thoughtful habit building. Even a few minutes of movement every hour can make a meaningful difference over time. Stiff joints soften when they're cared for regularly, the way a creaky door eases when it's oiled a little each day. Back pain, especially nerve-related back pain, requires a different kind of care. Instead of warming up stiff joints, the focus shifts to calming irritated nerves and strengthening the muscles that protect your spine. One of the first things I teach patients is to avoid positions that compress the lower back. For some, that means reducing long periods of sitting. For others, it means learning to hinge at the hips rather than rounding the spine when bending forward. When the spine moves in alignment, the nerves breathe easier and the muscles work more efficiently. Strengthening the core is another essential piece. Not the kind of core work you might associate with gym workouts, but deep, gentle engagement of the muscles that wrap around your abdomen and lower back like a supportive corset. These muscles act as stabilizers. When they are strong, they take pressure off the spine and help you move with more confidence. Simple exercises like the bridge, the bird dog, or controlled leg lifts can be transformative when done consistently and mindfully. Another practice I often recommend is learning how to relax the muscles surrounding the spine. It may sound surprising, but many older adults carry decades of tension in their lower backs without realizing it. This chronic tightness presses on nerves and makes back pain feel sharper. Gentle breathing techniques, slow stretching, and even a warm compress can help the muscles release their grip. Sometimes relief begins not with movement, but with stillness. One of the most important lessons I've learned as a physician is that healing is not a one-size-fits-all process. Each body has its own history, its own limitations, and its own way forward. What matters is understanding the root of your pain so that you can make choices aligned with your body's needs, rather than guessing in the dark. When you understand that arthritis thrives on gentle movement, while nerve pain demands careful alignment and muscle support, you begin to build a lifestyle that nurtures your health instead of aggravating your discomfort. And I want to remind you of something essential. You are not alone in this. Millions of older adults struggle with the same confusion, the same frustration, and the same questions. But knowledge gives you power. It turns fear into clarity. It takes you from feeling at the mercy of your pain to feeling in partnership with your body. I once had a patient tell me, after months of finally understanding her condition, "It feels like I got my body back." That is my hope for you too. Not perfection, not a pain-free life every single day, but confidence, understanding, and a sense of control that lets you live with more freedom and less worry. So as we prepare to transition into the final part of this video, I want you to take a moment to appreciate yourself. It takes courage to learn about your body. It takes strength to face discomfort with curiosity rather than fear. And it takes wisdom to recognize that healing is possible even after years of confusion. In the next and final section, we will bring everything together. You'll learn what steps to take moving forward, how to support both your joints and your spine, and how to live with more ease, comfort, and independence. You'll discover that the difference between arthritis and back pain is more than a medical distinction. It's a guide that can lead you toward a healthier, more confident future. As we reach the end of this journey together, I want to take a quiet moment with you. Place a hand gently on your chest and let yourself feel the life within you. Everything your body has carried, everything it has endured, and everything it still allows you to do each day is nothing short of remarkable. Pain may sometimes cloud your view, but it never takes away the deeper truth that your body is still working for you, still speaking to you, still asking to be understood. Throughout this discussion, you've learned how arthritis and back pain tell their stories in different ways. You've learned how to recognize their patterns and how to honor the signals your body sends. But there is something even more important that I hope you take with you today. Healing is not only about muscles, joints, or nerves. It is about the strength of your belief in yourself, the patience you offer your body, and the gratitude you choose to hold for the life within you. I have seen extraordinary things happen when people begin to trust their bodies again. When they move with intention, when they care for themselves gently, without judgment, when they understand that progress comes in small steps, not giant leaps, your body responds to kindness just as much as it responds to treatment. Sometimes that kindness is the very thing that allows healing to happen. So as you move forward, I want you to remember this. Your body is not failing you. It is guiding you. Every sensation is a message. Every improvement is a victory. Every day is a new opportunity to live with more awareness, more comfort, and more confidence. Thank you for spending this time with me. If this message touched your heart or helped you understand your body more clearly, I invite you to stay with us here at Senior Health Daily. Together, we'll continue learning, healing, and growing into the healthiest versions of ourselves.